My first guest is a doctor who specializes in pain management, preventive medicine, and what he calls an integrative approach to healthcare. If you're in pain or you just want to feel better, my advice, stick around for the latest edition of The Wellness Hour.
The Wellness Hour, an in-depth discussion with today's top physicians and medical leaders. And now, your host, Randy Alvarez.
You are watching the latest edition of The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, the new age of healthcare for the 21st century. My first guest is Dr. Scott J. Banks. Dr. Banks is the founder and clinical director of Banks Chiropractic and Wellness Center in Huntington, New York. He's here today to discuss his integrative approach to pain management. Dr. Banks, welcome to the show.
Thank you, Randy. I appreciate you having me.
Now, before we get into today's topic, tell us about your practice.
I have an integrative healthcare practice. We practice in Huntington, which is...
What does that mean, by the way, integrative?
Well, integrative means we've brought the best of Eastern medicine and Western medicine. I have a medical doctor that works with us. We have an acupuncture, chiropractic, massage, and of course, nutritional counseling for patients. So we try to bring in the best of all worlds to get the patients well.
Who's your typical patient that you're seeing?
A good typical patient for me is somebody that comes in with neck pain, back pain, numbness and tingling in their hands. They could have sciatica radiation going down their legs. They could have chronic headaches. That's a typical type of patient that comes in through the chiropractic door.
Now, we talked off camera, and you said you do more than maybe a typical office, chiropractic office, when it comes to back pain, neck pain, those kind of things. What do you mean?
Well, we try to get to the fundamental underlying cause of the patient's problems. And that often is an inflammatory process that's going on. It has a lot to do with body composition, diet, and lifestyle. So as a result of that, we see a lot of the patients that come in with high blood pressure, high cholesterol.
Is that right?
Syndrome X or insulin resistance type patients, diabetic patients, patients that need to lose anywhere from 20 pounds to a couple hundred pounds. So we run the gamut of pretty much just about everything, even patients that come in that feel like their mental power is starting to decline. They're losing some memory.
Now it says here you're dealing with intestinal health, just about everything. Is this your place, though, as a chiropractor?
Well, I feel that it is. As a chiropractor, I am a primary portal of entry, which means that a lot of patients come to see me first. And I feel that I have a responsibility to the patient to go over those kind of things with them, because if I don't, nobody else is going to do it. And if I don't, then the patient is going to continue to get worse. They're going to continue to run the pharmaceutical gamut, and there are alternatives out there. And at this point, I know too much to not turn back.
You said you were frustrated at one point.
Well, for many years, I've been in practice now for 25 years, so I was considered a straight chiropractor for many years. And what I mean by a straight chiropractor, you would just come in and get adjusted, subluxation only, the power that made the body heals the body. All right, and I believe in that premise. I believe that the subluxation, that the chiropractic adjustment is fundamental for a lot of patients. But I also believe that there is other things that need to be looked at as far as body composition goes, diet, the patient's chemistry. Now, I've been very well trained in this, so I can understand what's going on with the patient from a biochemical standpoint and intervene, more so than most doctors in my community when it comes to this.
According to my notes, you lecture to physicians about nutrition. Is that correct?
Yes, true. I have a group of doctors that sometimes changes, anywhere from 20 to 30 doctors that see me once a month. We have a dinner meeting, and I do a different topic on nutrition, whether it be on brain health or on cardiovascular support or intestinal health or detoxification. So there are many things that I will try to enlighten chiropractors, acupuncturists, nutritionists, naturopaths, medical doctors, DOs, on how to integrate nutrition into their practice.
Interesting. You also teach other chiropractors.
True. The New York Chiropractic Council, which is one of the associations in New York State, has asked me to do lectures for them around the state, teaching doctors on how to integrate nutrition into their chiropractic practice.
You recently got some national attention. It says here you were on the Dr. Phil show. Hollywood calls you with one of their weight loss patients. Is that correct?
Yes, that is true. I was on the Dr. Phil last year several times, working with a rather obese man who was 800 pounds.
So you're all over the place.
I don't want to toot my own horn, but yes, the Dr. Phil Show contacted me from California and asked if I wanted to take care of a patient. And of course, I jumped at that opportunity because the man needed some serious help and he needed it quickly.
You consult online, people from all over the world.
That's true. We've dedicated a lot of work and a lot of time to this by our website. I have clients all over the globe, every single continent, that people have contacted me what nutritional strategies would be best for their particular problems, and through the best of my ability, we're able to send questionnaires to these patients. Sometimes I'm able to do saliva testing or urine testing through different states. They send it to labs, I get the reports, and then I have a nice amount of information that I can really help this patient from far away. Okay. So home but not alone.
We've invited you on the show to talk about pain management, and you say you treat pain or approach pain a little different than many offices. So take me through the process. What do you do?
First, chiropractic is great to get patients out of pain. I mean, when patients come in with a headache, I know they're getting better. Patients come in with neck pain, back pain, they're getting better.
All the time. That's not an overstatement.
Most of the time. Not all the time. Most of the time. But most of the time, patients don't need surgery, even though they think that they do. I mean, I've had patients with herniated disc and a degenerated disc and osteoporosis and osteoarthritis and a whole bunch of complications and do very well in a relatively short period of time through chiropractic care. But Randy, I like to get to the fundamental underlying cause of the problem. And sometimes that problem could be what the patient's eating. They could have a very inflammatory type diet. It could be the medications that this patient is taking, depleting nutrients that they need to build their cartilage for their disc or to control inflammation. Okay. So it's a much more comprehensive approach.
You do testing as well?
Yes, we use Quest Diagnostic, which is a great lab by me that we will look at blood markers and try to pick up on that. But I also use some specialty labs, such as Great Smoky's Diagnostic Lab, Metametrics, Doctor's Data, saliva testing through Aeron Clinical Lab. So there's a lot of specialty tests that I will do as a clinician to look at blood, urine, saliva to get this patient well and not just get rid of their pain, and that's the key.
Okay, so by looking at, by using some of these tests, what does it tell you? I mean, what are you looking for? To the neck pain patient, back pain patient?
Well, we're looking to bring the patient back to harmony, bring the patient back to balance. So most doctors, everybody's very married to their cholesterol. And that's true. You don't want to have high LDL and low HDL and high total cholesterol. But there are other things to look at that are very, very important that a lot of doctors don't look at, that we make sure that we look at on just about every patient if they're willing to do that. The first thing that comes to mind is something known as homocysteine. Homocysteine is an amino acid. It's very abrasive. It damages the inside lining of your arteries. It can be depleted by not getting enough of the folate family of B vitamins in, or pharmaceuticals that are depleting those B vitamins. As a result of that, homocysteine goes up, you damage the lining of your arteries, it can lead to things such as depression, stroke, cardiovascular events, and even estrogen-related cancers. So that's a very important marker that patients need to be enlightened about.
How does it relate to pain, your pain patients?
Well, one of the most important, it's not so much homocysteine, but there's another very important marker that I like to look at, and it's called high sensitivity C-reactive protein. And that is also a very inexpensive test, and it's a marker for inflammation. So most patients that do come into a chiropractic office have a hot low back, have a hot neck.
What does that mean?
That means that they're inflamed, that they're going through a process of inflammation. It's a natural defense mechanism. So inflammation is a good thing, but you don't want it to be there all the time. I mean, you just look at the most commonly prescribed drugs. They're anti-inflammatories.
Well, tell me this, how do chiropractors normally handle this inflammation, and how do you differ? Maybe by taking it a step further.
Well, through chiropractic spinal adjustments, you can reduce pain and reduce inflammation. We use heat, and we use ice, and we use ultrasound and electric muscle stim and traction and deep tissue work, and that often gets rid of a lot of that, a lot of the inflammation. But there's also natural anti-inflammatories, boswellia, ginger, turmeric, proteolytic enzymes, and these things have been very well documented in the
medical literature. You put this all together for the patient in your practice?
Yes, I put we have a tremendous amount of information on the website that we put stuff together for patients. We have the protocol, so this is your pain and inflammation protocol.
Is that right?
So it's all written out. We were able to photocopy this, give it to the patients, and they have a prescription of what to do, and they can get better in a third of the amount of time.
So if there's a mistake in the world of pain management, the doctors, nationwide, maybe something they could be doing better. Would you say they're not looking at enough of nutrition? What's going on?
You know, that's a great question, because you see the top-selling drugs are non-steroidal anti-inflammatory drugs, and we look at the recent COX-2 inhibitors known as Celebrex, Vioxx, and Bextra have come under a tremendous amount of attack recently because of the cardiovascular events associated with that. So most doctors will just treat the pain and treat the symptoms. But when you do that, there's a downside. And the downside is that you damage your different parts of your body. I mean, non-steroidal anti-inflammatories can put a hole in your digestive tract.
But they do work. What are the alternatives? I mean, somebody's in pain, it helps them.
There are alternatives, and the alternatives are chiropractic, physical therapy, massage, exercise, diet, and very specific target anti-inflammatory type nutrients. And also nutrients that can help rebuild cartilage. All right, so you don't want to take a drug that's going to cause your cartilage to break down, where there are things out there in the marketplace
that can rebuild cartilage.
That can help rebuild cartilage. And then if you change your lifestyle around that, you can also slow down degenerative decline. You
said that oftentimes you're the last resort. Do many of your patients come to you that are on a lot of drugs for their pain?
During my initial intake, I always ask patients what pharmaceuticals they're on. So most times patients are on pain relievers if they come in for neck pain, back pain, but they're also on a lot of other different types of medications that can be causing their problem. And what I mean by that is that drugs can cause nutrient depletions. And you need nutrients to control inflammation, and you need nutrients to rebuild cartilage. So if you're taking a drug that's depleting those very essential nutrients, that can be giving you the pain for why you're in my office in the first place.
So give me an example.
Perfect example of that is the statin drugs. The statin drugs are also known as HMG coenzyme reductase inhibitors. These are drugs
like Lipitor?
Lipitor, Prevacor, Mevacor, all the statin drugs to lower cholesterol. These drugs also deplete a very specific nutrient called coenzyme Q10. Now, maybe a lot of people never heard of CoQ10, but it's an essential nutrient, and it's critical. And the older we get, the more CoQ10 we lose. And it's very important for how your cells make energy. So parts of your body that need the most amount of energy would be your brain, the lining of your stomach, your gums, and your skeletal muscle, and of course your heart. So if you deplete CoQ10, you can have problems in every single one of those parts of the body that I just mentioned. So in the case of a chiropractic patient that's coming in with spasm, they often are taking a statin drug to lower cholesterol that's depleting CoQ10, which is key to making their muscles work.
And that could cause muscle pain?
Yes, it can cause muscle pain, and under severe circumstances, it can cause something called rhabdomyolysis, which is rapid muscle loss. So before somebody gets to that point, they can have muscle dysfunction and muscle pain and muscle inflammation.
So would you say that these patients that come to you, they're taking these drugs, and it's caused by the drugs?
I say
to lower their
drugs,
cholesterol?
The drugs are a contributory factor.
Yeah, but they have high cholesterol. It lowers their cholesterol. So is it? So what do you recommend that they do?
Well, 60% of the patients that do die from heart attacks don't have cholesterol issues.
Okay.
So there are other things to look at, and that would be the homocysteine that we talked about before, and the inflammatory marker known as high sensitivity C-reactive protein. These are independent risk factors for cardiovascular disease. But you just can't take the spine and not look at it in the context of the whole body. So you need to look at that together. And to get back to your original question, yes, statin drugs can cause muscle spasm, and there are alternatives to taking statin drugs.
Is your goal to wean everybody off of these drugs?
Well,
because you work with a medical doctor.
I do. And we like to have patients wean off their drugs and to be able to monitor them and then put them onto nutraceuticals, change lifestyle, change dietary habits, look at stress, look at sleep.
You say nutraceuticals, what do you mean?
Nutraceuticals are nutrients that...
like vitamins, minerals you're talking about?
Yes, vitamins, minerals, oils, antioxidants, flavonoids. These are all very specific nutrients that interact with genes. And if you have to look at where healthcare is really going at this point, is the nutrient-gene interaction.
What do you mean?
Well, because of the human genome, all right, we all have a certain pattern of genetics, and there are certain uniquenesses between myself and you, and every single patient has them. And you can now look at, through very simple saliva testing, what this patient's uniquenesses are around their genetic profile. And so if they do have certain uniquenesses around homocysteine metabolism, then you can target very specifically with nutraceuticals or very specific nutrients to target those specific genes and change the outcome of that genetic profile.